Let's get ready.
Mornings in the Thierry household are like those in many other American homes. Shawn Thierry, a single mother, is getting her daughter Claire ready for school and has a jam-packed day herself. Thierry tries not to take any of their time together for granted, remembering sage words from her grandmother.
She would always say, I remember when I was a little girl, well, when a woman has a baby, that's the closest she's ever going to get to death. But that was true back in the, as they say, the old days. Women died in childbirth. And so I find it just boggling that in 2019 we're still having this conversation. I'm going to go get your clothes, Claire.
Texas is one of the most concerning maternal mortality rates in the country, estimated at 14.6 per 100,000 live births. For black women, it's even worse, 27.8 per 100,000. Shawn Thierry almost became one of the state's statistics herself while giving birth in 2012 to Claire.
I started to tell the doctors in the room, something's not right. I asked them to put me under, to give me full anesthesia, thinking that if somehow I wasn't conscious and awake of the level of pain that I was in, that maybe I could survive. And they said, well, the doctor's not even in the room. He has to make that order. And I just screamed, go get him.
Thierry doesn't remember much else other than waking up and finding out she had given birth. She says her doctor never explained what had happened.
Later I found out, a couple of nurses came in and they said that I had what's called a high block epidural, and that can be an adverse reaction when I believe it's put too high in your spine and the medicine goes to your heart instead of down to your legs, so it was paralyzing my heart.
Thierry believes her nurses and doctors didn't take her pain levels seriously. She says a University of Virginia report may hold the key as to why.
They surveyed medical students who actually believed that African Americans have thicker skin. They revealed that they thought that African Americans had a higher pain threshold. And so findings are coming out that blacks are less likely to receive pain medication in the ER.
As a black woman in Texas, Thierry knows all too well how big the problem is. She's a Texas House representative. Her district includes 3 of the zip codes with the highest maternal mortality rates. Driven by her personal ordeal, she's pushing the state to study maternal mortality, an issue that Dr. Carla Ortique says has become a crisis.
At least 50 to 80% of these deaths are preventable.
Ortique is vice chair of the Texas Maternal Mortality and Morbidity Task Force, which was established in 2013 to study the state's maternal mortality rate.
We know that for every maternal death, there are approximately 100 severe maternal morbidities. In other words, bad things that happen, near misses, near death instances. And so it's really important that we recognize that the mortality is just that. It's the tip of the iceberg.
Ortique says 55% of women who give birth in Texas are covered by Medicaid. Most lose that coverage 42 days after delivery.
And so it's likely not a coincidence that you see a higher incidence of death after that 42-day mark.
Texas has the largest uninsured rate in the country, in part because in 2012 the state legislature rejected billions of dollars in federal aid to expand Medicaid under the Affordable Care Act. Dr. Ortique says that decision, coupled with poverty, obesity and increases in opiate abuse, has served only to further marginalise those in need.
She was always experimenting with hair.
Cheryl Perkins's daughter Cassandra had insurance when she gave birth to twins Camille and Catriel, now 4 years old. She already had an older daughter, Journey, who is now 6. But even with insurance, doctors missed early signs of trouble.
She had went to the ER 22 times with no resolution, which that never should have happened, because, you know, it would seem like the doctors would say, why is this person coming back here? We're not doing something.
Cassandra was eventually diagnosed with an infection, and her labour was induced just 6 months into her pregnancy. Her twins weighed only 2 pounds each. She died a week and a half later after her liver failed.
Trying to get Camille's hair back in place.
Her mother is now raising 3 young children alone.
There. Catriel, go get brother's pole so he can eat.
Catriel, meanwhile, has been diagnosed with cerebral palsy and needs 24/7 assistance.
That is so hard.
3 years after Cassandra's death, Dr. Ortique's task force found that the rate of racial disparity had not changed. Mortality among black women was more than double that of white women. But though the state has since developed a better method that focuses on tracking numbers, it still does not include women who die outside the 42-day Medicaid cutoff.
Now this room here, this is our obstetric room.
Shawn Thierry has also proposed a maternal mortality and morbidity data registry bill, which would require collecting health data at the time a pregnant woman is admitted for delivery through 364 days postpartum. Under the bill, data would be collected on a daily basis and would include the most high-risk conditions such as hemorrhaging and pregnancy-induced hypertension. One of the reasons Thierry wants to introduce the data registry is so broader statistics can reinforce the severity of maternal deaths and set a new standard for states across the US. Thierry is also trying to pass 2 more bills. One would extend Medicaid coverage for eligible women up to 1 year after they deliver or experience a miscarriage. The other would require cultural competency training for medical professionals to remove bias in treatment of African American women, something the task force recommended. Physicians like Dr. Carla Ortique say that's fine, but only as long as it's voluntary.
While I did say I absolutely support having training, I can't say that I totally support mandates.
Meanwhile, the state has already made some changes to address maternal health issues. Texas Children's Hospital Women's Pavilion has its own intensive care ward within the Labour and Delivery Unit, the first of its kind in the country. And the Texas Department of State Health Services introduced maternal safety bundles, which detailed treatment policies, safety equipment, training programs, and internal reviews that every hospital should have. So far, 85% of birthing facilities in the state have rolled out the program.
You're putting 3 bills forward. What happens if they don't pass?
I'll be very disappointed. That's the first thing that's going to happen. But then after that, I'll have to wait 2 more years.
In fact, this month, her data registry bill was passed by the Texas House, but her 2 other bills were not granted a committee hearing. But she vows to keep up the fight, even if she has to wait for the next biennial legislative session.
Can Texas wait 2 more years?
One of the things I said in the very beginning is the time is now. We can't wait because we have a list of names of women that have lost their lives behind this. And they're real, I used to have a hashtag last session and it said real moms, real faces.